Hi, Dr. Larry Altshuler here, back with you about healthcare and healthcare reform. Telling you things that you will not hear from the media and you certainly won't hear from the politicians. Now, there are two main goals of the Affordable Care Act. One is to decrease healthcare costs and the other is to improve the quality of healthcare. In previous videos, I have addressed the Affordable Care Act's provisions to decrease healthcare costs. And as you know, if you've seen those videos, it's really not going to work very well and in fact can be more harmful. Well, the same is true about improving the quality of health care. And that's what this video is all about. So let's explore this. Now, one of the major areas in trying to improve the quality of care that the Affordable Care Act tries to focus on is in the area of research. The idea here is that if we can research and find out what works and what doesn't work, then that's what we really need to know to improve the quality of care. So the Affordable Care Act has done two things in that arena. Number one, they've established the Federal Coordinating Council for Comparative Effectiveness Research. Now, the purpose of this council is basically to compare research, one treatment against another, see what works the best. It is to evaluate the strengths and weaknesses of various medical interventions and tell us what works and what doesn't work. Now, that is on the surface, and I will tell you that's great. That's what we need to know, because less than 5% of our current research budget is in the area of comparative effectiveness research. And we need to know what works and what doesn't work. The problem is that this federal council is not going to succeed at doing that. And the major reason it's not is because the provision itself is self-defeating. Because when you look into the provision, it states this, and I'm going to quote this. This council is not allowed to use any of this information, quote, to recommend clinical guidelines for payment, for coverage, or for treatment. In other words, they can get all the information they want from comparative effectiveness research, but they can't use it. They can't make any suggestions. They can't change any treatments or guidelines. They can't use it at all. This provision is terribly self-defeating. It ties its own hands. And for that reason, it's not going to work at all. So you might say, well, what is this council going to do? Well, you have to go deeper into the provision to see that. And again, I'm going to read from the actual website. This council is to consider the needs of populations served by federal programs and opportunities to build and expand on current investments and priorities. Now, I'm going to tell you folks that this really has nothing to do with research at all. What this is talking about is allowing this council to go into areas and look at what's already being done, old programs and old priorities, and re-expand those and to expand upon them and to make more suggestions and more recommendations. It's a self-expanding, but it has nothing to do with research. It really has nothing to do with improving the quality of health care. It's simply going to expand the Affordable Care Act even more and spend a lot more of our time and money. In actuality, experts will tell you that the Federal Coordinating Council for Comparative Effectiveness Research is much like the British National Institute for Clinical Investigation, or Clinical Excellence, I think is what it's called. This allows the British medical system to decide whether whether patients should have access to certain treatments and certain drugs. And actually, it's a rationing type of provision. And that's really the underlying purpose of this council. And as you can see, it's really not going to be very effective. It's really not going to do anything about research, and it's not going to improve the quality of health care. Now, there's another aspect of research that was actually established in the stimulus bill, but was also backed up in the Affordable Care Act and funded by the Affordable Care Act, and that's called PCORI. That stands for Patient-Centered Outcomes Research Institute. The purpose of this institute, it has 21 members, and they are to evaluate the effectiveness of various medical interventions, including drugs and surgeries, treatments. It's a very broad aspect. Again, on the surface, this is great. We need to find out what works and what doesn't work. But just like the last provision, this provision is also self-defeating and ties our hands, because it specifically states that cost cannot be a factor. It cannot be used at all for any recommendations made by PCORI. Okay? So that means that if you have two treatments out here and they're, say, equally effective, if one costs $100,000 and one costs $1,000, you won't know what the costs are. They're equally effective and both of them can be used. The cost is not going to be a factor. So this really undoes the idea of even trying to decrease costs or finding cost-effective medical care. But PCORI, there are problems even beyond this. Just last month, PCORI came out with a list of the 5 areas that they think need to be focused on in all this research. Now, I will tell you that this covers every area of medical care. It's huge. It's extremely broad. For one thing, it took PCORI 2 years and 8 meetings to even come up with just this basic list. I can tell you right now, very inefficient, a lot of time consuming and money consuming. Well, that would kind of tell you where this is going to go. Because of all the broadness of what they want to do, it is literally going to take decades. I'm talking 20 to 30 years for them to come out with anything that is going to help us in the area of quality of care. The other aspect is that these are such broad areas that it's going to take a fortune to cover them all. And yet the budget for PCORI at the most is going to be $500 million a year. Now that may seem a lot to you, but the NIH budget for research is $30 billion a year. This is a drop in the bucket. This is like the government telling you, we want you to get this Rolls Royce, and we're going to give you $1,000 to get it with. That's basically what they're telling PCORI. Folks, this is not going to be helpful. On the surface, it's great. It needs to be done, but this is not the manner that it's going to be done with, I guarantee you. So unfortunately, in the area of research, the Affordable Care Act has gotten it wrong. It's very self-defeating. It ties our own hands, and it's just going to waste a lot of time and money. Now, with that in mind, there are some other aspects of the Affordable Care Act that also try to improve quality of care. That's going to be the focus for my next video. In the meantime, however, if you truly want to find out what really works and what doesn't work, you can go to my website and purchase my books. My website is balancedhealing.com, and there's a great amount of information that really tells you what works and what doesn't work. So with that in mind, I thank you for watching this video, and I hope that you'll tune in with my other videos, which are all listed on balancedhealing.com. Thank you.